I work in technical services, and so that encompasses food safety, animal welfare, quality assurance. We work really closely with operations and human safety, production, efficiency, really everything. So a lot of what my job does is if there's an issue with live animals, then usually I'm called, no matter what it is, just at least to put me in the loop if there's something I can help with. So Barb did say some things in her talk today that I think led quite nicely into mine, and I'm kind of glad that she covered the things that I'm not going to cover, so I think it gives you guys a broader perspective. When I started thinking about doing this talk, like I said, I haven't been in the industry very long, so it's not like I'm part of all these committees on emergency outbreak, disease outbreak response. But from what I understand, it's a very complicated network of people, organizations, states, producers, industry representatives, and so it's a network. And so what I started asking myself was where is the Packer in this complicated network? And that would be me. Where do I stand in all of this? And I think what I hope to show you today is that I think we're right in the middle, but sometimes we're not right in the middle of the conversation. And so I guess, I can't remember if Barb said it or Matt said it, but I think, I'm here opening line of communication, and hopefully from here we can maybe have some ideas of how to move forward with that relationship. Just to give you guys some perspective on how spread out we are as JBS, and I do have up here slaughter facilities. We do have the feedlots in here as well, which I believe there are 12 of them on this map. So this is not the most updated version. We did recently purchase Excel, as some of you probably know, so there's a couple more plants that would be added onto here. But if you look at our location of our slaughter facilities, we spread across the nation. So this has poultry, beef, swine. We have the capacity, just to give you guys some numbers in your head, they're not going to be precise, but it will give you an idea. I think on a daily basis in the U.S., we can slaughter 26,000 head of cattle, 6.6 million birds, chickens, 50,000 pigs, and 2,500 lambs. So there's a lot of throughput going through our plants daily. When I say those numbers out loud, it makes me very stressed that I oversee the welfare for all of them, but it's good. And so we also move animals in from Canada. We now are slaughtering animals in Canada, and we also can move things in from Mexico, and we do have some poultry facilities in Mexico as well. So there's a lot of movement and a lot of spread geographically. If we look here, and these are things that I know all of you are very familiar with on factors in animal disease outbreaks, but just to indicate to you some of the things on this list do have a direct impact on the Packer. JBS, we do own some feedlots. We have 5 Rivers, that's one of our business units. We own some pigs, but it's really not a very large percentage. I think it's less than 2% of our supply, so it's not significant. And then poultry obviously is more vertically integrated. I don't oversee the poultry welfare, so I'm not as familiar with their systems. But so, to give you some feedback on how it impacts us, a large number of animals, of course. I just told you the number of animals that we can slaughter on a daily basis, and that's a very large number. Potentially large in multiple geographic locations. We pretty much almost hit coast to coast, so we're involved. Whenever that would happen, we would probably have some involvement or invested interest in where an outbreak would happen. Animal health, of course, we do have, as I said, some production. We don't have tons, but their health impacts how they come to our facilities. Economic consequences, I'm going to go through some examples of trade later, but economically, when there's a big outbreak, we do take a big hit, and in the past, we've seen that, as is the whole industry, and I'll show you that. Human health, if we talk about the animals are infected and they get all the way to the plant and it's zoonotic, we have lots of employees at the plant, and if we needed to slaughter those animals or we decided it was safe for the food supply, it doesn't mean it would be safe for the humans there at the plant, so there's that concern as well. Production implications, we kind of talked about that already, from plant operations, but also from on-farm supply. Impacts movement. So I showed you the spread of our facilities across the country, and I'll go a little more in depth into some discussions of how we move animals across the country, but that certainly would be a huge impact for us. Animal concentration. Our feedlots are big. A lot of animals in one spot, and then of course food supply, and I think Barb she talked a lot about that, and obviously we are a processor, so the food supply would be very related to something that would impact us. So we look here, and we talk about outbreak response strategy, and really any sort of emergency management strategy response. program, and there's the general 4 steps: the prepare, prevent, respond, and recover. I highlighted this respond and recover because I think the packer is often involved at this point. So kind of once everything's happened and if we need to move into a recall state or anything like that, the response were brought into the discussion. Certainly the recovery were brought into the discussion, but I don't know that we're always part of this conversation. I'll discuss with you a couple things that we do have. Barb mentioned the food defense plan, and I'll talk about that really briefly since she already did it. Also about in-plant inspection, but I think there are probably some opportunities to expand where we can interact and help, because obviously something like a disease outbreak would impact from supply all the way through to consumer, and so we're right in the middle of that. By the way, this is, I know, haha, from the movie Outbreak, right? But the university veterinarian at K-State, his wife was part of that whole story with the outbreak, with the book, with Hot Zone and everything. So I thought that was kind of cool. They do a little example of what the movie was and what in reality it was, and it's very different. So I just thought that was my cool story that I have. It's the only one. So, and it wasn't even that cool, but thank you for laughing. I appreciate it. Okay. So outbreak response strategy. When we just talk about prevent, I mean, this is something that I don't need to belabor, but we do have biosecurity. So we have biosecurity at any of our production facilities, varying in degrees of what that means. We have it at the plant, feedlots, sow production units. So, I mean, we do have that in place. But I am going to talk to you about the in-plant procedures. And so Barb mentioned this very nicely, so I don't have to do it, but we have a food defense plan, and this really does focus more on the food supply. So it's not really a focus on the live animals. The food defense plan is, like this big. I looked through it, familiarized myself with it, and really the only part that could impact these animals, but it's still with the fact that the people are coming into the plant. So it doesn't address, like she said, first of all, the time in between when they arrive at the plant and when the time they leave the feedlot or wherever they're going from. It doesn't talk about that. I think from a packer perspective, we probably put the onus on the driver to pay attention to that, to stay with his animals, to the supplier who's hired the driver, and that's probably not very fair, since we say, hey, they're in your hands. When they get to us, they're in our hands, but we don't necessarily give them a lot of information or awareness or material to really deal with a situation like that. And one thing that Barb mentioned that I think from a packer perspective is a pretty big deal is that the onus from FSIS is being put on the packer to really step back and maybe be responsible for things that are happening pre-harvest. So that really expands the web of things that we are responsible for. And I think, I know tomorrow John Ruby, who I work with in tech service, is giving a talk on a comprehensive food safety system, which I think addresses just that. It goes all the way from, it starts with the supplier in pre-harvest, harvest, and then finished product to consumer. So as a federally inspected packing facility, we have multiple ones. So there is a presence of FSIS in the slaughter facilities, and so I would argue that this makes us a big part of the disease surveillance of any sort of outbreak. Also, we could potentially be the first identification of disease. So FSIS inspectors, they're trained on disease, symptom, and sign recognition. So that's part of their training. They have training materials on that. They do ante and postmortem inspection, as you heard from Barb. So they're definitely there looking for signs of disease. And if it's one that is questionable or one that's from an emerging disease, and they do categorize it in their training materials, then there's a very laid out line of communication on what needs to be communicated and how fast and how rapidly that needs to be done. And so Barb even mentioned, it goes to the district, it goes to APHIS, it goes to the state, and then all the way up to OIE if that was the case within 24 hours. So in-plant inspection does that for us. We're there in the plant, so then we have a direct line of communication knowing what's happening and what we need to know moving forward. So impact on operations. As I mentioned, movement of animals to slaughter is a big deal. We move animals all across the country. So swine and poultry, usually they're located a little nearer to the plants. It doesn't mean that they don't travel long distances from the finisher to the plant. So they do travel a distance, but it's usually more concentric, at least from our standpoint. Movement of cattle across the country is not necessarily always as efficient, and I think there's a big difference between fat cattle, so cattle coming from feedlots, versus dairy cows, which those are part of the program, dairy cattle that come from sale barns. So a dairy animal in a sale barn that we buy, it could have been 2 or other places, no other places, 3 other places before we get it. We do also transport animals a fairly significant distance sometimes. I know we've had ones from Idaho go to our plant in Arizona. So that's a long way, and it travels a lot of states. So one thing that we are working on internally is to, one, centralize this information, particularly on the sale barn side, to shorten the distance that cattle have to travel. So there's a number of reasons why we want to do that. Obviously, from an efficiency standpoint, it makes more sense, less cost to ship them. I think from an animal welfare standpoint, it makes more sense not to have the animals go through so many hands necessarily, and also come more directly to us. But in terms of the topic that we're discussing today, I think that will help also centralize and streamline the animal movement, so it's easier to track. So I spoke with our cattle procurement team at our office and just said, trying to have them help me out with, so if there was an outbreak, what would happen in terms of how we got cattle? And so their initial response was, well, we just would buy them somewhere else. So I had to ask about 5 times to finally get to the point where it would impact us. So I kept pushing them, and so basically, say there was an outbreak and this county in Texas, which, by the way, I'm from Rhode Island, so this is way bigger than my even state. But so say we had this county in Texas where we couldn't ship animals out of, couldn't go through. We do have a plant right here in Dumas. So if this shut down, it economically, just from our operations standpoint, it probably wouldn't have a huge impact. We could source cattle from other places, potentially paying a higher price from them. But that smaller region, I don't know what size the impact would be, but it would be minimal. So there's kind of tiers, I guess. Second tier was, say, I know, and I made a big jump, but say it's all of Texas. So we would shut down one of these plants here. It would be out of operation. So animals that we already had purchased or that we had contracts with in either Oklahoma or Kansas could go to our other double shift facilities here. Those 2 blue dots, one in Colorado and one in Nebraska. And I should mention that one in Texas is a double shift plant. So that, I think their ultimate capacity is a little over 5,000 a day. We could also operate to make up for that loss in that plant being shut down, we could operate on Saturdays. So once again, there might be some impact, but we can make that work, probably without a huge financial burden. So I kept asking, so what happens next? So they told me, boom, if we blacked out, and it's not necessarily going to be those 3 states, but if we had to shut down or couldn't fill our 3 double shift plants, that's where it would really, really hit home. I mean, that would be a capacity of 15,000 a day. We wouldn't be able to kill those animals, and our other plants, which are smaller, would not, 1, be able to make up for that difference, 2, we couldn't get the animals there, or if we could, the expense and the amount of manpower and the implication for potentially animal welfare would be huge. So that was kind of, I guess, the tipping point for sourcing animals. So disease outbreak of the past, one thing that in talking to the different people at my company, one thing that came up, I guess, obviously, was BSE. So I'm going to walk through that quickly. But so what have we learned from our past? So when BSE broke out, when the crisis hit, there wasn't a lot of information on the disease, a lot of uncertainty, huge market closure. And so, the question kind of was there another option? So through World Trade Organization, the countries that are part of this, the countries have sovereign rights. So they protect the animal and human health of their country. So if there's a big disease outbreak and no one knows anything about it and they're uncertain, what would be the knee-jerk reaction? Of course it would be to protect what you have and what's close. But what happened since then, and it happened slowly, and it's probably still happening, but we've learned a lot of things about BSE and of this disease. And so we're not talking specifically so much about BSE, but if you think broader picture of any disease of something that we don't know a lot about, or these emerging ones. So we learned all these things, and then I think the big thing that I'm going to hit on is the importance of traceability. If we had a robust traceability system in 2003 that we could isolate and identify and then control, would we have had such a big impact? So one question when we discuss traceability is, what does this mean? How far back do we mean? Because I think some people say, yeah, this country has traceability, but how far back? From birth or just from point of purchase? And so after BSE, and I think still continuing, there's obviously discussion about the fact that we need a robust traceability system. It's a necessary component of understanding and controlling this disease outbreak. USDA began working on this. There was discussion on mandate versus voluntary. Obviously, people don't like things that are mandatory. Mandatory. There you go. That's the mix of all of them, right? Mandate. You guys can use that one. I'll let you, right? Mandated. Voluntary is a little more preferable, but it doesn't always mean it happens, right? So now I think state-by-state traceability, and there's people in the room that might be able to tell me if I'm close or not, but traceability from a breeding stock standpoint, we've done, or we're closer to. As a packer, we do maintain records for our cattle origin, right? But what that means to us is immediate source. So they're assigned a lot number at purchase. We have the producer information. We have the drive number, so that's the order that they're killed in, and then we have an individual carcass ID. So we do have that. Certain verified programs will trace back to birth. So if that's part of a program, something that we sell and it needs to go all the way back to birth, for instance, we have a natural program, which has nothing to do with the fact that we need traceability for disease, but we go all the way back to the ranch because we need to know that that animal hasn't had antibiotics and it goes through the whole system. But that's not for everything. And then once again, I think there's a big difference between the feedlot/ranch animals and the sale barn/dairy animals. So we probably know a little bit better the feedlot animals. The dairy animals, or the sale barn animals, I guess they're not all dairy. We know what sale barn we got them from, but granted, there's several steps behind that we don't necessarily know. Someone else may know. So how can we minimize financial devastation the next time, question mark, if there is a next time, of something like BSE? So there's always going to be that knee-jerk reaction, but can we minimize it? And I think that was a lot of discussion moving forward with trade agreements. Can we minimize this so it's not a huge economic devastation for whatever country is involved? Is there sort of a rational approach that we can take? And so the WTO, now there are some, between certain countries, there are some clauses that identify a disease outbreak. And if this happened, we would take these steps rather than saying, boom, closed, no more trade. And so one concept that is still, it's still being discussed is regionalization. So basically what that means is what it sounds like. If there's been an area that's identified as unsafe within a country, that area is unsafe, not the entire country. So it's an ability to continue trade and not devastate a country. And I think that's something that we've learned in the past from BSE. So just to show you guys a couple things from an economic standpoint, how we as a packer can feel the impact of a disease outbreak. This is the U.S. beef exports, and right here is when BSE hit. So you can see, it went from up here, we've been climbing, to boom, 0, and we're just getting back up to where we were prior to BSE. So that's huge. I also have some other examples from our other protein portions of our company. So this is poultry. So we have a couple H5N1 outbreaks, and so this is in frozen leg quarter prices on export. We didn't see this in the volume numbers. It was seen more in the price numbers, but we did see it there. You can trace that, and it's interesting talking to our trading people because they can point out on the graph exactly where these things happened and link them. And it is pretty easy if you look at the dates and the peaks. So here we have pork, just a couple examples, and so it works the reverse too. We can be hurt by that, but we also can increase our trade if a country's suffering from that. So just to show you, Korean outbreak of foot and mouth here, there was a big peak in our export in pounds. And then we have China here, and here's a little more of an active graph. Blue ear down to, we have the U.S. swine flu here, and then up again to foot and mouth. So we can see this economically. So logistics of an outbreak. I'm just going to talk a little bit about depopulation. So in the event of an outbreak, we isolate it, we ID, and we need to stamp out, depopulize mass euthanasia. So I'm giving you guys all these vocabulary words that you didn't know you had. So we want to minimize depopulation while maximizing disease control. So to walk through an example, and obviously this is an extreme example, but maybe it's not, depending on the situation. So say we had FMD at one of our feedlots. The current practice in talking to them is that they would do just what we've said, identify, isolate, and stamp out. So let's just say usually there's about 70,000 animals there. Let's say you had to stamp out 70,000 animals. And I'm not going to get into the best way or most humane way or aesthetically pleasing way to euthanize that many animals, but what makes sense at that feedlot is to bring them through the processing shed and knock them with a captive bolt gun. So if you think about that, a normal operation, I mean, they do process animals through these processing sheds, and I guess I'm not being totally fair here in my calculation because sometimes feedlots, they do have more than one processing area. But say they had one, they had 70,000 animals. On a good day, they can put 1,200 to 1,300 of those animals through there an hour, and that's assuming that the animal is walking out of there. So if you're putting an animal in and you're killing it and it's not going to be walking out, that's going to greatly reduce the amount of time that it takes you to euthanize all those animals. So we're talking a huge amount of time, a huge amount of manpower, weeks to stamp out those animals. Sometimes feed on hand is an issue. So I think from my perspective, and granted this is a very one-sided, small example, I took a lot of the complication out of it, but it could have negative impacts on animal welfare. So I guess my question is, in looking through all of this, is that, for example, that 70,000 feedlot is 12 miles down the road from one of our packing plants. So why not utilize the locations that are designed to euthanize the animals in this type of outbreak? We are in the slaughtering business. That's what we do. We're professionals at it. We have the facilities to do it. So is it possible to figure out a way to transport these animals out of a feedlot to euthanize at a packing facility without compromising human health and food safety? So I understand that there's a lot of different things that can come into that question, and it probably is very situational, situation specific. I guess the second question is, would it be better to get the animals healthy and put into the food supply if it could be done safely? And I think this leads exactly into what Barb was talking about with the public perception. So even if there's not any sort of implication for food safety and the food safe, and this is happening right now, would people want to eat it? And so do we have the communication and the education materials and the information that we need to say, yes, this is healthy and it's okay for you to eat, and you do want to eat it, because that's a lot of product that we have that we wouldn't be able to get rid of. It's also a lot of animals that would be wasted, in my mind. I mean, it would be a shame. So I don't know that we know where we are with that issue. But so, once again, just looking at this map of us, as I said, we're all across the nation, and if you superimpose all the other big packers, small packers, small packing plants on top of that, I mean, I think we got the nation covered in terms of location for us to do this type of slaughtering activity in the event we needed to depopulate or have the animals get better and then slaughter them eventually in some sort of outbreak organized fashion. So as I mentioned from the beginning, I think and I know the packer is in the middle. We buy from the supplier, we slaughter the animals, we process them, and we sell them to the consumer. So I think we take a lot of the economic hit, as does everyone else within the chain, but we have a lot of invested interest in this, and I think as much as we're in the middle, I think sometimes we're not part of the conversation. So we'd be willing to be, and I think that can help make the network stronger. And I guess I see people smiling. Maybe people have tried to put us in the middle before and be part of the conversation, and I apologize if we haven't been there, but I'm here and JBS is here, so I think that's the next step.